When someone calls 911 for a drug overdose, it is often too late. Some of the signs and symptoms that you may see with somebody who is having an overdose is they may be pale, they may have snoring respirations, or having a hard time breathing. They may even not be breathing. They may also be sick to their stomach and throwing up. Let's just take a few minutes and review the recovery position. The recovery position is used to protect the person's airway, who you suspect might have taken a drug overdose. Things not to do. You don't want to throw ice on them, and you certainly don't want to throw a bucket of water on them. The recovery position is very easy and simple to do, and I'm going to demonstrate that for you. First, you want to take their left hand and put it above their head. Next, you're going to grab a hold of their body, and you're going to roll them towards you. You want to make sure that you use the knee as sort of a prop to keep them in the recovery position, and I'm going to demonstrate this now. Now again, this ensures that the person's airway is clear in case if they happen to throw up and it clogs their airway.
Hello, my name's Jeff Bickford, and I've done a wide variety of hard drugs over the years from age 14 till 30 years old, including IV drugs. And I can remember times, especially early on, when being a product of the late 60s, there's certainly a lot of opium and heroin, morphine sulfate. The latter, other pharmaceutical drugs such as the barbiturate class, liquid, secanols, Nebutol, some Demerol, and certainly an abundance of crystal meth. And unfortunately, I remember all too well. I also know the risk involved of using hard drugs, primarily through my own experiences, and also, unfortunately, because I've seen the death of many, or far too many of my friends over the years because of their own drug use. Luckily, I've been in recovery for over 20 years, and obviously, for those who use drugs, I would prefer to see them in recovery on their own and learn to live clean and sober, but I also know how difficult it really is. So in the meantime, my preference is that you can learn to reduce your risk of overdose and death by remembering these simple facts. First of all is never share needles. Serious illnesses like hepatitis and HIV are on the rise, and it would be important to find where there's a local needle exchange program in your area. Secondly, there is an importance to learn that mixing similar drugs has a synergistic effect and can be extremely dangerous. And in fact, 75% of people who die from drug overdoses, it is found that they have mixed similar drugs, such as the sedative types, which are Valiums, Klonopins, Xanax, or other depressants such as alcohol, and the opiates, analgesics. And what this does is these mixtures, they kind of enhance the effect of the central nervous system, and they just have a tendency to slow the heart rate and respiratory rate, and for some of the unfortunate people, they stop breathing and die. Lastly, an important point to remember is that when people stop using, their tolerance decreases. So if you haven't used in a while, it means that you can't use as much as you used to because of this tolerance factor. So if you've been in jail or abstinent for any other particular reason, then don't think that you can go back and start using as much as you used to use before you stopped using. You just can't do that. and people make that mistake far too often. So remembering these facts can hopefully lead to more safety factors for you, and your risk of overdose and death will certainly be decreased. So they'd be around long enough so that there may be a chance that you will take the risk and enter recovery and try not to use at all. That would be my hope. So please take care.
I'm Nancy Moore, the Program Director and a nurse at Discovery House in Waterville. Liquid methadone from methadone maintenance treatment programs is a synthetic opiate prescribed by a doctor for the treatment of opiate addiction. Mixing methadone with other drugs or using methadone that's not prescribed for you can cause you to stop breathing and die. People think that methadone sold on the street, most often in pill form, is safe to use because it's a prescription. It isn't. It is never safe to use methadone without medical supervision. My message to you is that methadone used outside of treatment or when mixed with other drugs can lead to overdose and death.
This video was created to help inform people who use drugs, their friends and family, about how to prevent overdose. We all have family, patients, friends, and neighbors like you who have overdosed. Some of them have died. We want to be sure that you have the facts. Number 1, resuming use of drugs after jail and treatment and using similar amounts prior to treatment can result in overdose. Number 2, using in a new setting and using an unfamiliar source of drug can lead to an increased risk of overdose. Number 3, mixing drugs, alcohol, and methadone can lead to respiratory arrest and death. Number 4, never use drugs alone. Use where others are present so that they can use the recovery position and call 911 should an overdose occur. And number 5, when an overdose does occur, be sure to use the recovery position and call 911.
Hello, I'm Dr. Thomas McDermott. I'm a board-certified family practitioner practicing in Waterville, and I'm an addiction specialist certified by the American Society on Addiction Medicine. I'm also a member of the Governor's Commission on Substance Abuse of the state of Maine. I'm here to talk to you about the problems with opiate use and abuse in the state of Maine. We have one of the highest rates of opiate and prescription opiate use per person in the country. The best thing to do is to use opiates only when prescribed by a physician and in situations that they are needed. If you are using them, then the next best thing is to get treatment by a trained professional and stop your use as soon as possible. If you continue to use and are not ready to stop, then recognizing high-risk situations are important. You should not use alone. Other people should be aware of your use and be around when you're using. Secondly, you should not use with other drugs. You should not use drugs that you don't know what they are or are not sure of where they've come from. That these are times when people go into respiratory arrest and die. If you are using, you should be aware of your friends who are using. If you're not alone, signs of respiratory arrest are snoring, sleeping in the corner, and these people should be not left by themselves because they may die.
We appreciate the willingness of the family of Dr. McDermott to continue to use his message SAFE in the hope that it will save lives.